Hello, this is Dr. Dylan. Today's discussion will be on the coronavirus infection, which has been covered quite widely, not only in the news media but also social media, and creating some fear and panic. So, in this presentation, we'll look at the facts to see if our fear and panic is justified, preventative measures, and treatment. This recent outbreak of coronavirus started in the city of Wuhan in China and subsequently spread to other cities and now has spread to multiple countries around the globe as depicted by this map. The red area shows nations where coronavirus cases have been confirmed. Blue areas where cases are suspected but not yet confirmed. So far, as of February 1st, 2020, over 12,000 cases have been reported worldwide with 259 deaths. Majority of the cases reported in China, followed by Thailand, Singapore, Japan, and Hong Kong. So far, 9 cases have been reported in the United States. Coronavirus is a virus that not only infects humans but also animals. In humans, it causes influenza or common cold-like symptoms. Rarely, the animal coronavirus can mutate or evolve and infect humans. Previous outbreaks of coronaviruses included 2003, when coronavirus outbreak occurred due to spread of virus from animal source to humans via civet cats, resulting in the SARS syndrome or the severe acute respiratory syndrome, which had a mortality rate of about 10%. And in 2012, the MERS syndrome, Middle Eastern Respiratory Syndrome, with the virus spread to humans via camels. The mortality rate with the Middle Eastern Respiratory Syndrome was from 30 to 50% depending on different studies. A recent study published in the prestigious British journal The Lancet involved a study of 99 patients at the Genitra Hospital in Wuhan City, China from January 1st to January 25th. And as the table shows, the common symptoms tend to be fever, cough, shortness of breath, and muscle aches and pains. And surprisingly, flu-like symptoms such as runny nose is relatively quite rare. The mortality rate, or the percentage of deaths reported in this study, was 11%. However, if one divides 259 deaths by 12,000, you get a mortality rate of approximately 2.2%. But remember that these cases are still evolving, so the final mortality rate is yet unknown. Now, as I mentioned earlier, this recent outbreak of coronavirus has received quite a lot of media attention. On the other hand, the influenza virus, which has resulted in 19 million cases in the United States so far during this flu season, resulting in 180,000 hospitalizations, approximately 10,000 deaths, has received relatively little coverage. In 2017, the influenza virus resulted in 810,000 hospitalizations and approximately 61,000 deaths. So this begs the question, why is it that the coronavirus has received a lot more media coverage, whereas the influenza virus, which has resulted in far more deaths in the United States, and coronavirus has resulted in no deaths but only 9 cases, has received a lot of coverage? Part of this is to do with the fear of the unknown. Now, as I said previously, animal coronaviruses rarely spread to humans and cause infection, whereas the influenza virus has been around for many, many decades. And yes, it does cause a lot of hospitalizations and many millions of cases each year. But given that it's so frequent, our fear of something that is well known is relatively far less than something that occurs relatively rarely. There was a Chapman University study conducted called American Fears. It found that even though 1 in 7 Americans will die of heart disease and only 1 in 45,000 will die from terrorism, terrorism was in the top 5 worries of American public. So when something is new or remote, our fears and anxiety not only increase, but because the future with new threats is rather unpredictable than something that we are already used to, this does lead to heightened anxiety and increased panic. And this does not only apply to coronavirus infection in humans, but anything that is new to us that we are not used to, whether it's terrorism, coronavirus infection, or airplane crashes. Now remember, this is not the first time coronavirus has caused human infection, or rather animal coronavirus has caused human infection. Previously, reported cases were in 2003 and 2012, and both of those outbreaks, the SARS outbreak and the MERS outbreak, were contained with good common sense preventative measures. These measures include good hygiene, i.e. hand washing. Wash your hands for at least 20 seconds with soap and water. If soap and water is not available, use alcohol-based hand sanitizers. These viruses that cause flu-like symptoms, the common cold virus or the coronavirus, are spread through respiratory droplets. So when you sneeze or cough, cover your mouth and nose with paper towel or a tissue paper and dispose of these immediately, and then wash your hands. Furthermore, if you think that your hands have been in contact with an infected surface or an individual, please do not touch your mouth, nose, or eyes with infected hands. Wash the hands first. If you happen to be in overcrowded places, try and use a face mask. And wipe dirty infected surfaces with antiseptic cleaning solutions. Treatment. Now, there is no vaccine or cure for the coronavirus. Unfortunately, there have been reports in the social media by some individuals of glorified solutions that one can ingest, and apparently these can eradicate the coronavirus. Please ignore such reports. These antiseptic solutions are dangerous to the health and can lead to severe complications. Antiseptics, yes, they can kill a coronavirus. So bleach can theoretically kill coronavirus, but we do not ingest bleach. Antiseptics are used only to wipe inanimate surfaces, wipe objects. They are not to be ingested. So treatment includes treatment of fever, cough, and sore throat. If children or teenagers have fever, please do not administer aspirin, as this can rarely cause a severe liver complication. Another thing that's overlooked is hydration. When you have fever And especially if you have fever with respiratory illness, there's increased amount of insensible water loss through the throat and the nose, i.e. the respiratory tree, and the skin surface through evaporation. So unless you increase your fluid intake, you can become dehydrated. Dehydrated individuals, their ability to recover from illness is severely diminished. So make sure you are well hydrated. Unless there's a contraindication, for example, if you have kidney failure or heart failure, then your fluid intake may be restricted. In that case, seek medical advice. Now, if your symptoms worsen, you should definitely seek medical advice. For example, if symptoms of breathlessness worsen, you should go to medical center or the hospital, where you may require chest x-ray and other tests to see if the influenza or the coronavirus has resulted in secondary infections such as pneumonia or bronchitis, which will need to be treated. And you may require oxygen therapy or assistance with breathing, either through augmented ventilation or through medication to help you breathe easier. So in a nutshell, if your symptoms worsen, please seek medical attention. In summary, yes, this coronavirus outbreak has caused public anxiety. Please take preventative measures, but remember, far more common and you are far more likely to contract the common cold virus, and the same preventative measures will reduce the chance of you contracting the common cold virus. The common cold virus causes millions of cases in the United States each flu season, resulting in thousands of deaths, as we discussed earlier. That's it with this brief presentation. If you like the presentation, please subscribe to the channel, share this presentation with others so we can disseminate the information and hopefully reduce the panic. Take care and stay safe.